Neglected tropical diseases, NTDs, are endemic across the African continent, where there is limited or no access to quality and affordable health services and no access to sanitation and clean water. The African Medicines Agency is envisioned to enhance the capacity of state parties in the African Union to regulate medical products and technologies to improve access to quality and address health challenges such as neglected tropical disease prevalence. Well, for more insights on this, we're joined by Chimwemwe Chamdimba, Head of Health at the AU Development Agency, AUDA-NEPAD. Chimwemwe, good to speak to you as always. Appreciate your time. Now, let's start off with how the UNHCR's Assistant High Commissioner, I beg your pardon, actually, that's not where we'd like to start. Let's start with the neglected tropical diseases. Just put us in layman's terms, what are they?
Well, neglected tropical diseases are diseases, a 20 group of diseases that disproportionately affect those people that are in poor communities mainly. And they're neglected because, yes, in their sense, they're neglected by public health systems most of the times, as well as even the funding entities when it comes to funding for these diseases, mainly because they are targeting the poor populations that really the pharmaceutical companies, for instance, have no incentive to invest in neglected tropical diseases. So this group of diseases are diseases like sleeping sickness, diseases like the trypanosomiasis that we all know, which is sleeping sickness, the river blindness. These are diseases that have been with us for the longest time. However, the attention that has been given to these diseases is very minimal. That a lot needs to be, it leaves a lot to be desired when it comes to actions that need to be taken for us to tackle these neglected tropical diseases. Unfortunately, they still affect a lot of people globally. If you look at the data that was published by WHO in 2002, it indicates that globally there were about 1.7 billion people that were affected by neglected tropical diseases, mainly in the tropics and subtropics. However, if you look at it on the African continent, 40% of these billions are in Africa. What does it mean? It means that this is a huge challenge on the continent, and we all need to really focus on finding solutions to these neglected tropical diseases. Unfortunately, as I said, when you look at the diagnostic tools that are available to diagnose these treatments, they are not, up to date. It takes time to diagnose these diseases. And even if they are diagnosed, the treatments that are available, the medicines that are available, are also equally not that effective. They take long, the treatment time for, to resolve these challenges, as well as their safety, their efficacy. It leaves a lot to be desired. So it's a real challenge on the continent that all of us need to hold hands and tackle these neglected tropical diseases.
Well, one of the things that we talked about in that intro that I read a few minutes ago was the fact that many of these are found in areas of great poverty. And that really speaks to a big part of the African continent.
Exactly. It does speak to a big part of the African population, to the big part of the African continent. This is why these are supposed to be diseases of interest to our continent. And I think if we are talking about development of the continent, if we are talking about the continent moving a needle to achieving the Agenda 2063, the Africa we want, we need to address such diseases that affect the poor. Because if we want to improve education, we need healthy people to be educated and healthy people to be employed in the employment sector, so that really this translates into development of the continent. So these are diseases of interest, and from our side as the African Union Development Agency, as the development agency of the AU, we cannot look the other way. We have to work with our member states to tackle these diseases. Our desire, as you have already talked about in your introduction, that we are operationalizing the African Medicines Agency. The African Medicines Agency's role is to bring innovative medicines, innovative technologies, vaccines, diagnostics that respond to the diseases of priority to the continent. Therefore, the role that we play as African Union Development Agency in building the technical capacity of the African Medicines Agency through our program on the African Medicines Regulatory Harmonization, it really responds to some of these diseases that are of priority to the continent. We want to make sure that these treatments, these remedies are available and are accessible to our population.
Chimwemwe, can you provide some examples that showcase some of the progress that has been made by various African countries in dealing with these NTDs?
Yes, as much as we are talking about this as a problem, that the continent is grappling with neglected tropical diseases, I think we have to celebrate some of the milestones that we have made when it comes to tackling these diseases, despite the challenges that we have in access to quality-assured, safe medications that target these diseases. If you look at the report that was published by WHO in 2022 on neglected tropical diseases, you will realize that 47 African countries recorded that they had eliminated at least one neglected tropical disease. I will mention in particular 4 countries that made real significant progress. Togo, for instance, it eliminated 4 neglected tropical diseases. They were able to eliminate diseases such as elephantiasis, diseases such as sleeping sickness, the disease such as trachoma, as well as Guinea worm disease, which is also typical to the African continent. Another country that also made significant progress is Malawi. Malawi was able to eliminate trachoma, as well as Guinea. Guinea was also able to eliminate trachoma. And DRC was also able to eliminate Guinea worm disease. This tells us that the continent is really moving a needle forward. But I think we need to do more. We need to put our money where our mouth is. We need to put resources, because I talked about 20 group of diseases. We are talking about only a few that have been eliminated. We need to put more effort to eliminate the rest of neglected tropical diseases that are affecting the African continent. But progress has been made, as you're rightly saying.
Chimwemwe, obviously there's a big correlation between political will and putting in the necessary effort. Now, all too often, again, because it's the marginalized members of our communities that are largely impacted by NTDs and other illnesses, and these people are largely also the voiceless, right? So where does political will and the need for governments to put emphasis and focus on eliminating these NTDs come together? Well,
I think, let me start from where you started to talk about political will. I think political will has been there. In a few years back, we saw the African governments coming together in Rwanda and adopting the Rwanda Declaration. We have also, through the WHO, developed a strategy to eliminate neglected tropical diseases. But as you're rightly saying, when you put in place these strategies and when there's that political will, it has to be followed by action. Of late, these countries that I've talked about that have been able to eliminate some of these diseases, they've been able to establish programs that are targeting neglected tropical diseases. But as I said, at the center of it, we need to develop new tools. We need to make them available to the population and accessible to the population so that they're able to respond to the diseases in the wider population. Also, on the other side, when you were introducing the subject, you talked about access to medicines, which the African Medicines Agency, it came as a political will, it came as a political decision. African Union heads of state deciding to say, well, we want to establish an agency of the African Union that will focus on making sure that the medical products that the population needs are available and they are safe and of good quality and they are efficacious. That political will translated into action. We are here talking about the establishment of the African Medicines Agency, the treaty coming into force 2 years ago, and us piloting different standards, tools, and processes to make sure that we attract investments in the health sector of the African continent. We attract investment into research, into these new tools that we need to eliminate diseases like neglected tropical diseases. We attract investments into pharmaceutical production on the continent, because if the continent can't do it by itself, nobody else will come and do it for us. Because these are our people, these are our poor people that we are talking about. And we are the ones that are to find solutions to our own problems. So we're really trying to balance between the political will, the strategies that are being developed at the continental level, and translate them into actions at the continental level as well as at the national level.
I like the fact that you speak about trying to strike a balance. Now, how do you strike a balance between the need to deal with NTDs, right, But also they need to deal with many other diseases. I mean, you've got diseases like tuberculosis, for instance. You've got HIV and AIDS, which have ravaged many African countries. So where a country has X amount in its budget, is it not torn then between, do we deal with NTDs that affect a smaller number of our population, or do we deal with something like HIV and AIDS or tuberculosis, or in this instance, you know, a few years ago we had to deal with the COVID pandemic, which obviously put many other issues at bay because it became right at the forefront.
Well, I think you're right to say that we have so many challenges, but we can't ignore a certain part of our population that is still affected by these diseases because they cause death, they cause pain, you know, they cause disability, deformation that our population suffers. And I think if we are to move, I mean, if we are to talk about inclusive development, we cannot ignore this part of the population. I want to talk about one or two statistics. I think data that is out there, that is available, shows that neglected tropical diseases cause a wage loss of up to $33 billion. And the investment of $1 in dealing with neglected tropical diseases translates into $25 benefits to the economy. That tells us a lot that we can't ignore. This is significant. But however, I think you're right to say that we need to adopt integrated public health policies, integrated public health strategies, and implement integrated public health service delivery if we are to address the public health challenges of the continent, because we cannot be isolating one disease at a time. If we invest in health R&D, that health R&D will be able to respond to all the priority diseases of the continent. If we invest in pharmaceutical manufacturing, that pharmaceutical manufacturing has to target the diseases that are of priority to the continent. Recently, as AUDA-NEPAD, as the African Union Development Agency, we led the development of a criteria for selecting priority products that are going to be targeted for continental review and continental assessment to make them available to the populations. And we looked at priority diseases of the continent, these neglected diseases that nobody would like to look at. But as a continent, these are our diseases. We have to address them. We have to deal with them if we are to talk about development of the continent. So you're right. We can't be talking about one disease at a time. We need to have an integrated approach. And this is what we are promoting as the African Union Development Agency.
Well, you're at a conference, side event at the African Union Summit at the moment, and these are obviously conversations that you're having. Just how much appetite is there to push the needle forward, to use your own term? Is that something that we can expect that there's going to be a lot of aggressive recommendations, if you can call it that, to get the ball rolling some more, if you will?
Yes, definitely. I think health remains at the center of the African Union's agenda. We saw what we went through during the COVID time. We saw how we suffered when it comes to access to medical products, access to the technologies that we needed to deal with our health challenges. And as a result, the African Union has made sure that in every summit, we focus on the targets that we have set for ourselves as African Union. And I think I'll be happy to indicate that one of the priorities that the African Union Summit is going to focus on is the African Medicines Agency. We are currently giving a report to the heads of state in the summit that is currently ongoing on the progress that we have made in operationalizing the African Medicines Agency, both from the governance side of things as well as the technical side of things, in collaboration with our colleagues at the Commission as well as our colleagues at the Africa CTC. So yes, it remains a priority, and we have had discussions, deep discussions with member states' commitment to ensure that African Medicines Agency becomes operational in the shortest possible time. And we leverage on the progress that we have made in the African Medicines Regulatory Harmonization, collectively with the regional economic communities and our national regulatory authorities. So yes, I think the commitment is there, and we would like to push the needle forward so that we make medicines, medical devices, diagnostics, and vaccines available to the populations that need them on the continent.
Chimwemwe Chamdimba, Head of Health at the AU Development Agency, AUDA-NEPAD. Appreciate your time this evening.